back to another episode of Spermidine Life. Today we're going to be talking about an important topic, hormone imbalances. We're going to be joining our patient, Jelena, and she'll be talking about her symptoms, her lifestyles, and what she's been trying to do to fix these problems. And let's find out if Spermidine Life is good for her and resolving this. Hi, I'm Dr. Halland. I'm here with Jelena today, and we're going to go on a journey with her, discover what's actually going on with her health, and are there ways we can help her improve it. And one of the ways we can improve health is actually through supplementation and other lifestyle things. So, Jelena, great to see you. You've actually been a client of ours for quite a bit. Could you actually share with the audience a little bit about your history, what you've been involved in, or what do you think could be done for your health?
Thank you for having me. I'm super excited to share my story. I will talk a lot about my hormones since that was, predominantly most of my battles. And it started long ago. I was actually 18, not even 19 years old when I was diagnosed with a dermoid tumor,
Mm,
which, most of people don't know what that means. It's really actually benign, but it can destroy your reproductive health if it goes untreated. Basically, it's not one of those things that just like goes away. So it was extremely painful. It was extremely large. And I had two surgeries and finally partial ovarectomy. My right ovary had to be removed completely.
mhm.
And it kind of left me scarred. I don't know if that's the right word, as far as my hormonal health and balance and so on and so forth. So my body, because I was so young, thankfully, um, adjusted and my periods would come on
Right.
time, actually, very, I say Swiss watch like, very precise. But I did have a lot of issues as far as PMS syndromes and whatnot, and that became uh visibly worse in my 30s. And then right now it's a hot mess,
Yeah.
in a lot of better words. So periods come and go as they want. My mood is a disaster. I go up and down. Usually, most of it is down, so it's from either like from extreme fatigue to irritability to passive aggressive to back to moody, back to low. So every day is it takes a lot of mental stamina to get through the days. And for those who have never battled any kind of hormonal issues, it's hard to kind of comprehend how severe these
Hmm.
symptoms are. And as far as the physical symptom, periods when they do come, they're extremely painful. My belly, I'm a very skinny person. I do have pictures to prove before and after, because sometimes people don't believe what happens with my body. From the moment I start bleeding, like 3 hours into it, it will look like I'm like 6 to 7 months pregnant. Like my body goes completely out of whack. Like I am in somebody else's body. I sometimes, because I'm funny by nature, I'm like, I'm surprised I didn't get stretch marks from it, because it's a huge variation. Like you don't recognize me. Like I don't recognize myself. Lower back feels like it's fractured. I can go on and on and on, but pretty severe. So
Right.
basically, all of my health issues, I would say, the cortisol levels out of whack. I would say I would like that to be in range to some kind of a baseline at least, so I can go on and breathe again. Because if you count, even if you know when your period is going to come, if you
Hmm.
count the days in a month of PMS, going through it and then coming off of it, you have pretty much 7 to 10 good days that you consider that you feel semi-normal and vibrant, which I don't even know what that means anymore.
Right.
Vibrant.
So
I would like to feel alive when I wake up.
So the problem is you basically have what we call hormone disruption. Things don't feel normal on the inside, and then physically you're having quite a lot of actually complaints and symptoms as well. Extreme bloating, water retention, and really this was all stemming from a combination of you had a surgery, and then this obviously caused a big endocrine disruption in your body, and now you don't even have a consistent period. Is that correct?
Yes, I mean, it's the age, of course, because we're all getting older versus
Right.
younger. As far as as far as the hormones, you as a woman, you come to a certain age, and then naturally everything, your progesterone and your estrogen, everything kind of like testosterone goes down, gets mellow, but cortisol levels get higher to our horror. So it's
Right.
definitely not a good mix of things. Plus my past. That's
Right.
exactly why I brought it up, because I'm sure it played a role, significant role
And
in
this
all
has
of
been
this.
going on for a long time then. This is not like a few days, a few weeks, a few months. This we're talking like
No,
years of symptoms,
lifetime.
lifetime of
Yeah.
symptoms.
Uh, I don't want to put anybody down as far as, the medical community, but I will say this because it's the truth. Whenever you would go to your regular doctor, who's the gynecologist, who's trained to help you, or at least you would hope so, uh, the panels that they do, they're not complete. And the panels that they do, the ranges are off.
Mhm.
So they would come back at me and say your hormones are fine, which is far from the truth.
Right.
So you're kind of like, okay, now what do I do? I know this is not fine. I know I feel horrible. Where do I seek for help? Which is how, the whole biohacking, how you venture out to save yourself,
Right.
to use pain as your gift, and so on and so forth.
And it's interesting. There's a lot of people who are actually on their own personal journey for health and wellness because traditional medicine doesn't necessarily fix this because in some senses, unless you're sick enough where you can get a pill or a surgery, sometimes
Mhm.
medicine doesn't actually have an option for you because they say, well, there's no medication for your pre-diabetes. There's no medication for people who are, for example, smokers but don't have emphysema. But when you do have these problems, we can treat you. And in your particular case, you're still young by all standards, but you're now having things that would probably be more common in someone who's older, or maybe in menopause, or maybe who's someone who had a lot of other medical problems, but you're actually at a pretty young age. And we're seeing this. A lot of people who are younger are actually experiencing symptoms and problems that usually typically affect people who are later in life, maybe someone our parents' age. And that's kind of what I've been noticing where medicine's having a gap is that medicine's not used to having so many people who are younger having these problems, number one. And number two, medicine's not really equipped with functionally treating things that don't actually have a specific, let's say, prescribed medication to treat it. Because you don't really fit under a certain umbrella with your current symptoms.
Right.
Like what have you been diagnosed with? Or what is the current way they want you to get treated? Or is this, let's see what happens, wait and see?
Right, right. I mean, it's hard to answer that. Like I just would hope that gynecologists would open their minds and really acknowledge this as a real issue
Right.
with women, because most of us suffer in silence,
Yep.
because we are told that this is kind of normal, and it's pretty much what it is. It's a little bit of suffering, and
Mhm.
for most of us it's a lot of suffering. The way we carry it, sure, we are strong, but at the same time, um it causes a serious, especially mental health. Even, like, forget about all the physical symptoms, forget about being, feeling bloated and looking like a hippo at the seventh month of pregnancy, which you're not even close to being pregnant. Like, forget about all of that. What it does with your head, with your emotions, that's, I mean, it's serious, very, very serious. I have days when I'm suicidal.
Mhm.
That's not a joke. I
Right.
don't think that would be a shot, like, oh, you're fine. Yeah, no, no, I'm not fine. I promise you, I am
And
far from fine. And
and
the only reason why I'm standing here still strong, it's my mental health and my understanding of, this is not me. This is my hormones
right.
that are ruling my personality right now, and pretty much like changing everything that I am. And it's hard. That's something you cannot, unfortunately, control. This is not one of those things when you wake up in the morning and you're like, I'm gonna be strong, let's do some affirmations, let's meditate. Yeah, yeah, that's not gonna help with this.
Right. So let's learn about your lifestyle. I mean, it seems like you're pretty healthy. Do you work out regularly?
Yes, I do.
And do you smoke, drink?
Smoking is a big no. I've never had a cigarette in my life.
Mhm.
And socially drinking, which lately, yeah, I have an aversion to alcohol. I can't describe it, but that's what's happening.
So
So
you would
yeah.
be what we describe quite healthy in lifestyle, and then you eat right, from my assumption,
I am. I am.
balanced diet. Okay, great. What are the top three physical and or mental symptoms that you're experiencing because of your hormone imbalance?
The lack of strength. My muscle mass is not getting stronger and it's not retained. I don't retain muscle. It's hard to explain. Fatigue and extreme tiredness. I push myself with, the power of my mind. But if I were to ask my body how I really feel, I would be in bed probably 22 hours a day. I would just sleep and then sleep some more. That's how I really, really feel.
Okay. So basically, one, you're really not able to put on muscle mass. Two, you feel very tired and fatigued. Three, essentially, your mood is really not the best. Sometimes you have good
Not
days
bad.
and you have days that you feel.
Mhm.
Okay. And so obviously, one of the things that we try to approach, we kind of discussed that being on antidepressants or medications are really not for you. And quite frankly, your symptoms are not because you have a, let's say, neurotransmitter imbalance. Your body's just out of balance, whether or not it's because there's not enough nutrients in your body. Obviously there's a hormone disruption, and so that's when I think supplements can actually be quite useful. And so we actually were talking a bit earlier about a supplement called Spermidine. And so how did you learn about Spermidine? It's kind of this newer, I mean, honestly, really popular product now, at least in the longevity biohacking circles. How did you find out about it?
I like to research a lot, and I came across this amazing doctor from Arizona. Her name is Dr. Elizabeth Yurth, and she was raving about this supplement. I'm talking incredible things. She has said about it. So it just, it caught my eye and my ear, and that's how, yeah.
Okay. So obviously you're very heavy into research. You happen to be checking online, found information about spermidine. And are there any questions you have about this product that you would like to know?
Does one take it from now till forever? Do you cycle? Do you take a month, 2 months, 3 months, then you stop? That would be my first
Okay. That's a great
question.
question. I mean, some supplements you take daily, right? Like a multivitamin, just because sometimes we don't get enough, nutrients from our diet. It's not nutrient dense. With spermidine, it's basically a senolytic. So what does that mean? It gets rid of zombie cells, and these older zombie cells don't function the way that the zombie cells don't function like healthy cells. So because they're hanging around in the body, not doing things that are helpful, they actually can cause inflammation. And so these cells causing inflammation in the body are a big problem. And so taking a senolytic like spermidine is actually very useful in clearing out these zombie cells. Some people cycle it. We've actually talked to people, and there's some interesting research where you can do 1 month on, 1 month off. Some people, they get continuous. It really kind of depends on a few things. What's your health like? Do you have chronic conditions? What's your energy like? Are you really low energy? Do you have some sort of condition where you feel inflamed a lot? Are you older and producing more zombie cells than normal? If you're younger, and you're, let's say 50 is the halfway point of being younger, you could probably take it 1 month off, 1 month on, and 1 month off. If you're older, or let's say have more inflammation, you could do it continuously. So that's kind of like a rough guideline. It really depends on your actual physical health situation, some of your genetics, and your lifestyle. There's 5 things that I think contribute to longevity. One is basically the inflammation in your body that causes aging. We have your immune system. We have things like stress, detoxification, and mindset. And so I always go deeper into all of that. But what I like about certain products is that when they really target inflammation or help your immune system or even help detox, that's when you're really going to actually start seeing the body. Now, stress is very interrelated to what I call neuroendocrine, things that affect the neuroendocrine system, your brain, your hormones, all the things that connect in the neurotransmitter. We call that like stress, right? But stress is a combination of cortisol and everything else. And then everything on top of that is your mindset. What we want to discover today now, you had mentioned you're interested in starting spermidine. So what are you hoping to see as a result of taking this compound that's helpful for getting rid of these old cells causing inflammation in your body?
What I'm hoping for is to wake up in the morning and feel life force, feel energy from my own self, not from coffee, not from 10,000 different tricks to get my engine going, and then to get it going through adrenaline and cortisol and then run on that stress induced, let me survive and get through the day, and then get caught in that, catch 22, like when you're trying to bite your own tail. That's exactly what I'm living.
Hmm.
Like I wanna have energy. As simple as that sounds, it's
Hmm.
just something that I think is very profound for me.
Right.
And another thing that I want to add about spermidine, that this autophagy part of the story
Yep.
that spermidine does, right? So fasting is a beautiful thing, right? And it's a beautiful thing maybe for you and for somebody else. For me,
Mm.
I, with my hormones being the way they are, and let's say that I'm still in reproductive years, and then the way I lose muscle so fast, I cannot be really intermittent fasting, and
Right.
my prolonged hours of not eating just causes even more stress on my already stressed body.
Hmm.
My thyroid gland, they say I'm hypothyroidism, which is crazy because I'm so skinny. So thyroid is suffering, endocrine is suffering. I cannot be fasting. Like, I know it's a beautiful thing for most of population, but for me, for example, is not. So I'm hoping for spermidine to give me that piece of a puzzle that I cannot get with
Right.
fasting. I cannot be fasting, and I wish that somebody had explained this to me years ago when I was doing all these crazy diets and fasting and whatnot, thinking it's really healthy for me. It's not for me. I'm
Right.
not that, I think spermidine is really God's given gift to people like us, to women like us, especially,
Hmm.
with the issues with hormones and whatnot. I think it's huge.
Yeah, no, you bring up a good point because autophagy is our body's way of clearing out old cells, and that's because it compartment or well basically it digests and eats up all these little old cells and tries to recycle these parts. And so with autophagy, what's interesting about spermidine is that I like to call it fasting in a bottle because you don't have to do the whole not eating part. You can just take the spermidine and then essentially your body stimulates or it mimics this fasting routine. So I'm very excited to actually hear about this result. You have a very, what I think, common use case where a lot of women are having hormone problems at a younger age. A lot of people don't have the energy, they're not feeling good, and they're looking for an answer. And traditional medicine basically doesn't have the answer because you don't necessarily need to be on hormones. You're not classically what we call depressed or anxious. Your body's out of dysregulation. And we call that
Yes.
you're not in homeostasis. Homeostasis means in
Yes,
balance.
not in
You're
homeostasis.
out of
You're not in
homeostasis.
balance. Yeah.
And so I think senolytics, which is what this is a category of, which is basically getting rid of old cells, hopefully will put your body in senolytics. So let's try it out. Let's have you start on spermidine and see what your results are like. And we'll follow up in just a bit. Maybe we'll give it a few weeks to see how you're doing. How's that sound?
Sounds amazing.
All right,
Sounds really, really exciting.
let's do
Thank
it.
you so
Of
much.
course, my
Let's
pleasure. All right, we'll
Thank
check
you.
in with you just a bit. We'll stay tuned.
Okay.
One of the reasons why I think spermidine could actually help Jelena is because her problems are most likely due to inflammation, which is causing an imbalance in her hormones. Spermidine actually triggers a thing called autophagy, and so by getting rid of these old senolytic cells, we're going to decrease the inflammation in her body, and that's most likely going to be one of the reasons why her hormones will get back on track. Stay tuned. We're going to be following up with Jelena in 1 month to see if there's any differences in her symptoms or feelings. And let's find out if spermidine was the right solution for her.